Hello and welcome back to the channel. In this video, I'm going to be talking about a really important guideline that has come from the World Health Organization. This was released in December 2023, so not long ago. And essentially, this is a guideline for low back pain. Now, as you know, low back pain is by far the most disabling condition in the whole wide world within the medical diagnostic criteria that's available. Really, it is. In fact, the number of people struggling with low back pain alone constitutes a huge number going into the billions. It is roughly more than 10% of the world's population, as far as I'm aware from last reading there. The numbers would have gone up much more. Indeed, chronic pain itself is 20% of the world's population. So if you're having a population of 8 billion, we are looking at 1.6 going close to 2 billion with chronic pain. And low back pain is one of the most common forms of persistent chronic pain that is available. Now, this particular guideline from WHO is essentially focusing on one particular aspect of chronic low back pain. And this is something that doesn't come out very well, and it needs to be made very clear that this is very different from the other guidelines because they have specifically looked at one form of low back pain called chronic primary low back pain. And what this means is that this is a form of low back pain in which there is no structural, i.e. damage to the discs, the joints, etc. at any point of time. This is a form of primary low back pain which is often due to a sensitization and an upregulation in the sensitivity of the nervous system in the periphery, meaning around the lower back, and centrally within the spinal cord going to the brain. It's quite relevant. They've looked at whatever guidelines that are there, whatever studies that have been done globally. They've identified that there wasn't a comprehensive guideline that looked at primary chronic low back pain, and hence this was made. What this essentially is for is again for the primary and community care. So it's for the patients who are at the first level of approaching their primary care physicians or their intermediate care clinicians in the community. It does not apply to the management of acute pain in the hospitals or any other form of specialist kind of pain setting, even if it is what we know as secondary care or specialist care. Okay, so that's the important part, that this is a guideline for the treatment and management of chronic primary low back pain in a community setting. What they did was to look at 37 interventions across 5 broad classes. All of these are non-surgical interventions, mind you, so we're not talking about surgery here. These are 37 non-surgical interventions across 5 classes. The 5 classes, first one being physical therapies, another one being education, the third being psychological therapies, the fourth being medications, and the last being multimodal therapies, all brought together. Overall, there were a number of individual interventions within these 37 interventions there and these classes. And what the WHO has found is about 19 of these were recommended against. So the WHO actually found that within these 5 classes, 19 of these interventions, 37 non-surgical interventions, they actually recommended against. Only 10 of them were in favor. What's important to remember with these guidelines is actually that they realized that most of the studies on which the guideline was made on, these studies were all small in number, they were limited in duration, and more importantly, they often had isolated parts of care. So that's a big issue there, that we've not got a proper, unified, good way to manage our patients with chronic primary low back pain. And that is something this guideline recognized. And what it really made sense for is they wanted all the clinicians, and that's why the target of this guideline is all clinicians in a primary health care or a community care setting across the world. What the WHO wanted were 4 broad principles that they had every healthcare system across the world to incorporate. And more importantly, my take on these 4 principles as well, and more ideally what they then wanted was the next steps to practice. The broad principles that they wanted of course a holistic way of supporting people. They wanted an equitable access to care. They wanted to ensure that there is coordinated and integrated care provided for people with comorbidities as well. And ultimately, they also wanted to ensure that it was personalized and contextualized to the needs of the people. So that was the rationale and the principles behind the WHO. The reasons are quite obvious. As I've said before, low back pain is the most important reason for disability and productivity loss. In the UK itself, there's data to suggest that almost 12 billion pounds of productivity loss occurs annually to the economy just because of low back pain alone. There is also a recognition by the WHO that primary care systems across the world, community health systems, need to be strengthened. So this guideline makes sense when you have a condition that is a public health problem, which we understand has to be done differently. What do you take into practice? Well, the most important thing is to have a thorough biopsychosocial assessment of these patients, ensure that is there. The second thing that the guideline insists for is to make sure that we have taken into the needs of the patient and then provide a personalized and an individualized treatment plan, and to understand that there are treatments that are not going to be effective for everyone. So again, the third aspect is not to provide one intervention at a time, but to actually consider that many people will need a package of few interventions. So the 5 classes, education, medicines, multidisciplinary care, physical therapy or psychological therapies, we still need to be providing a package of these interventions rather than just one thing, and that is important there. Ultimately, what this guideline is hoping for is that if you can take into practice the way of listening to the patient, reinforcing this, and then giving them the right kind of support, validating their story, and then giving them the appropriate treatment, that can be a really good way. And clinically, this makes sense because with chronic primary low back pain, when the nervous system is known to be sensitized, techniques that calm the nervous system down are going to be most effective. And in this scenario, most of the drugs that we have, including the opioids or the antidepressant or many other injection form of treatments, apparently and evidence-wise do not help. So check out the main link for the WHO guideline will be in the notes, and I hope that this video has been of use and value to you. Thank you so much.